regarding the cardiovascular issues that have been reported, if you could elaborate a bit more on how are you looking at these issues of, patients report, how does the WHO reports on this and collects data on this?
So thank you for the question. It's a really important question. As we learn, as Mike has just said, as we learn more and more about this virus, I have to remind myself that we're in month 5 of this pandemic. And although it has seemed like an incredibly long time, we're at the very, very early stages of our understanding of how this virus affects the body, how disease progresses, what diseases that this infection causes. We have a global clinical network that we've brought together. We bring this same group of clinicians across the globe together for other diseases. We activated this group very early in January to bring together clinicians who have experience with treating COVID-19 patients. And the value in doing that is you're putting clinicians talking to clinicians with firsthand experience of what they're actually seeing in terms of the patients, in terms of what those patients are dealing with, and what those doctors and nurses and medical professionals are doing to try to save their lives and to try to prevent them from progressing to severe disease. The way in which we gather information about symptoms or disease is through a standardized set of data that needs to be collected from patients. It's very difficult to collect a standardized set of data from patients when you're in the middle of a very intense outbreak and you're just trying to save as many lives as you can. But in some countries, and in many countries that don't see intense transmission right now, especially in the beginning, what we did is we set up a clinical case report form, which is something that was developed with WHO and ISARC, which is the International Severe Acute Respiratory Infection Consortium, and many partners, many clinicians and nurses and medical practitioners across the globe to set up a case report form that collected a set amount of data from each patient. And in doing so, that helps us gather information so that we can analyze it and say, is this common? Is that not common? Is it associated with COVID-19 infection? What does the presence of smoking or an underlying condition have to make that condition worse? So we set up this case report form. It is being used now. It took some time to get going. And there's more than 10,000 case records in this. And we are hoping that more and more case records can be obtained so that we could better understand this. In addition, we're working with a number of countries who are conducting their own studies in their hospitals. Some of these are coming out through peer-reviewed publications, but those are done by individual hospitals. And that information is really critical for us to gather an evidence base to really understand what's happening. But with these syndromes, with these new syndromes that we hear about, those are identified by astute clinicians, astute nurses, astute medical professionals. And it's important that that's characterized. You've heard of this hyperinflammatory syndrome in children. That is something that is now being looked at by clinicians. This is among children, a very rare condition that seems to be among children. This is being looked at globally now. And there will be a case report form specifically for that so that we can collect standardized information and be able to understand this disease further.